Reproductive, maternal, child and adolescent health. This is a program of the H6 partners supporting alignment of country priorities to the global priorities in the area of RMNCAH, convening partners around key issues in health.
From a UN Women perspective, the entire contribution has been to address the whole issue of gender equality, male engagement and ending violence against women.
For WHO, we focused on access to services and then very importantly also the quality of services. And then we've added as a third component the capacity building of the health workers.
As UNAIDS, we have prepared county profiles because we need to come up with population location focused approach, which means which population is being most affected by the epidemic.
That each child really grows up in the best of health. That means physical health and actually mental health as well. And hence, grows up in a family that is able to provide for all this and access all this.
I think that opportunity has allowed us to be able to strengthen the evidence base, to strengthen the strategic advocacy, to enrich policy as well as service delivery, so that at the end of the day, the quality of care that ultimately the Kenyan receives is improved.
As a country, the maternal mortality ratio had improved from 488 per 100,000 in 2009 to about 362. But the worst affected counties, which were 6 counties out of the 15, were isolated as the ones that contribute up to 50% of the maternal mortality burden. And this is Mandera, Wajir, Marsabit, Isiolo, Lamu, and Migori County.
The model of focusing on primary health care and community health service as the top priority for investment is critical. You measure success in health through the various health indicators. What is the maternal mortality? What is the infant mortality? How many children are malnourished? What is the level of various diseases? What is the lifespan and all this? And all these indicators will contribute to the lifespan.
And those counties were then isolated to try and find out what are the issues that are contributing to this. And of course, globally as a country, we appreciate that there are, broadly 3 issues. One is on access to services. Secondly, demand and utilization for the services. And thirdly, accountability or performance monitoring, meaning that the quality of services being offered in most of these places may not be meeting the standards.
The CHMT has also been trained. The sub-county health management teams have been trained to make sure that they are at par in tandem with the improvement mode in the county. And that is why we are getting increased number of skilled deliveries, reduced maternal neonatal deaths. Even when it happens, we have a chance of auditing.
So the activity as chair, we normally do default tracing, referral for ANC, FP, immunization, TB patients at the community level. We also refer for skill delivery at facility level. We also do outreaches at community level. We screen under 5 children.
Na saa hii tumeweza kuendelea, tunawaleta karibu, tunajua lugha za kuongea pamoja na wao. Ndio ambaye anaitwa Kodi. Tumeshaona kwa mapicha ama kwa video watu.
Alice alikuwa anakuja kunitembelea na ananiambia nisiwe nakosa kwenda clinic na ninaenda ili nisikuje nikapatwa na magonjwa.
Hata wazee wao wakiwaleta hapo wao tunawachukua, tunaongea pamoja na wao. Unamuonyesha ni kupangilia vizuri, mnakuwa na maisha mazuri, mama anakuwa na afya nzuri, mtoto anakuwa na afya nzuri. Kwa hivyo hata yule mwanaume anaelewa na anakuambia hata anaenda kuambia wengine na anawaleta.
But after the Unfpa have trained them and mostly the TBAs and we have a maternity, they are referring to us. First ANC has picked, we could get about 5, 6. We are now receiving up to 11 to 15 new ANCs at first level, that is the first trimester, before 3 months, so that we can manage this mother from the word go as we manage that pregnancy.
The person we pick as a community health volunteer lives in that community. He knows everybody. The 20 households around that homestead, he knows them, he or she knows them. That person has more power to effect change at that level, so long as you have trained them on the right thing and they have also those kind of applications and technology that we have put in their hand.
Well, since this theatre has been established, this locality has seen a lot of improvement in terms of hospital indicators, the reproductive, maternal, neonatal and child health. Because before now we were not conducting cesarean sections, and if we what we used to do was to refer mothers to either Garissa or to Wajir, which is a distance of more than 200 for Garissa and more than 100 for Wajir.
That night, yenye nilikuwa na labor pain, the security was not good. Kulikuwa na mambo ya shifta, watu walikuwa wanapigana. A big improvement because kwa saizi tuko na mali penye tunaweza kurest. Kuna manases ambao they can give you some advices on how you can keep safe and give birth safely. Yeah, kuna so big differences. Yeah, everything was okay.
Actually, 2 new ambulances were purchased, and then 5 ambulances were upgraded to basic life support and 1 to advanced life support. And therefore, even the healthcare providers were trained on basic life.
Basically, when we started, the main hospital, we had 34 deliveries in a month from a bed capacity of 10 to 23, and through many other supports like demand creation, community awareness on importance of ANC, tracing of adolescent pregnant mothers, sensitization and training of community health volunteers, incentives like mama kits, and the renovated maternity was not able to accommodate the number. We managed to have the constructed building as maternal and child health complex, where we are housing all the maternal health services under one roof. That is one-stop shop for maternal and child health.
The mere fact that there's an increase in skill delivery, that has an association to reduced maternal deaths and also perinatal deaths.
Before the training, I used to see most young girls coming to the hospital, some were pregnant already. Most people, including the general public and even the healthcare providers, put the blame on the young girls who are already pregnant. We were trained on what we need to feel, how to collect the evidence. Apart from the medical provision and psychological support to the survivor, there was that gap of what next after this.
Nilipata nilikuwa class 6, nilikuwa na miaka 16. Wakanifukuza nyumbani, nikaenda kichaka. Sina mama nyumbani, mama alikuwa chisi kidogo, nikaenda kwao. Wakati waliponirudisha, nilimwambia baba poleni, si kupenda kwangu.
This is someone you are preparing psychologically to live beyond stigma, to go back to the society. So if you don't take care of the society, this crime took place, then you are like doing nothing.
When we talk about maternal health, it's not one standalone intervention, but it's a very much like, comprehensive, integrated services that we need to provide. The objective is basically to capacitate the institution that are supposed to providing, the actual service delivery.
So that we raise the national averages by targeting specifically where the problem is. You have to find out who is it that is left most behind by applying these criteria.
There's so much that we require in terms of sustaining the gains that we have made, because it takes a lot to ensure that we sustain the functionality of the community unit that we have, which include, of course, addressing the issues of human resource gap, which has been our major challenge.
County governments have invested in infrastructure, they have invested in their own human resource, because one of the key challenges in the areas that we work, especially in the 5 counties of from Mandera all the way to Lamu, is the high staff turnover.
So I think the equity lens, which is very much part and parcel of what the SDGs are all about, understanding actually the very specific issues in those localities, because you can't have one size fits all in a country like Kenya, which is so diverse.
What has been the most critical result that we've been able to do, which would answer the question of long-term sustainability, is the fact that we've been able to show that a little investment done right and done smartly can change the output. And by that, we've been able to motivate investment by the counties themselves in those critical areas. And it is the investment that the counties make over a period of time that can sustain services, sustain the quality, and have the greater long-lasting impact. The political will that this partnership has been able to midwife is what has been critical and what will remain critical to getting results.
So it's a collaboration that was well thought and well executed.